Good morning, everybody. Today I am going to pitch a therapeutic model. It's called child-parent relational therapy. So first, I will provide a little bit of background history on child-parent relational therapy. Child-parent relational therapy was developed by Gary L. Landreth, Sue C. Brighton, and was developed off of inspiration from the filial therapy model, which was originally developed by Bernard Gurney. CPRT was developed with the understanding of the foundational components of child-centered play therapy, which suggests children's innate tendency towards achievement is present when given supportive opportunities and appropriate reinforcement from caregivers. CPRT focuses on group sessions consisting of dyadic interactions and opportunities for supervision and feedback, which sets apart CPRT from other parent-child therapeutic modalities. CPRT provides unique and developmentally sensitive interventions to support parents' ability to adapt to, empathize with, and understand their children's underlying psychological and emotional needs. Lastly, child-parent relational therapy encourages parents to respond with increased empathy to children's behavioral developmental needs and emotional impairments. CPRT was first developed to support parents' tendency to respond to children's emotional and behavioral needs and support co-regulation. Some of the theoretical assumptions that are underlining CPRT is that CPRT aims to strengthen parent-child relationships based on the theory of child-centered play therapy, which understands children's innate tendency towards growth, achievement, and self-actualization. CCPT, which is the child-centered play therapy, it focuses on interventions aimed to support the person of the child, present rather than past, feelings rather than thoughts, understanding rather than explaining, accepting rather than correcting, child direction rather than instruction, and child's wisdom rather than therapist's knowledge. CPRT integrates these fundamental components to support parents' ability to foster safe interactions that support children's development, as well as fosters opportunity for secure attachment between parent and caregiver. Lastly, CPRT views children's mental health and psychological well-being to develop from a secure attachment and emotional bonds between parents and children. Major concepts of CPRT consisting of how problems are understood. CPRT regards presenting problems through a systemic lens, supporting parents to develop skills such as reflective listening, recognizing and responding to children's needs, setting limits, and building self-esteem. CPRT focuses on specific patterns of behavioral, psychological, and emotional responses from the child and parental responses to the children's behavior and underlying emotion. CPRT does not attend to the problem or conflict, but rather patterns of children's unmet emotional needs and parents' responding behaviors to lead to sustainable implications post-treatment. The goal of therapy is to support the secure attachment between the child and caregiver and children's innate tendency towards growth, creativity, and healing. CPRT has an emphasis on warmth, problem solving, affectionate responses, and trusting interactions. And lastly, CPRT contributes to the reduction of both behavioral and emotional behavioral issues, development of coping strategies, and increased feelings of self-worth and confidence for the child, coupled with increased parental efficacy and satisfaction for parents, supporting an adaptive family system. Toys and materials that are going to be selected are going to be all toys that are that supports the child's desire to be creative. Toys will be utilized contingent upon child's direction. And so all activities will be child directed rather than therapist directed or parent directed. Toys and materials consist of a sand tray, and this would help to facilitate the exploration of children's and parents' inner world. Markers, construction paper, and scissors. Doll houses to also explore the children's perspective of family dynamics, such as roles, rules, and boundaries in the family system. Toys, those can be used for imaginative play, use of characters in sand trays, and can be used on the rug also, which is a toy town play rug, which encourages children to explore the understanding of their social world through play. Additional toys include cups, sticks, and spoons. This can be used to help parents and children create a worry doll so that they have a coping mechanism to express worries in the event that they occur. In children's reading books to foster opportunities for emotional intimacy. And this is just an example of some of the toys that would be in the therapeutic space. The therapeutic space is going to consist of chairs, cubbies, tables, beanbags, sofas, emotion charts, colorful paintings, neutral colors, lamps with warm lighting, easels, and rugs. The goal of the therapeutic space is to provide a safe and warm and welcoming environment for children and parents to engage in creative and interactive play. And this is just an example of some of the items that would be in the therapeutic space. We have a table for activities. This is the town rug that allows therapists and parents insight into the child's perception of their social world, and cubbies for organization and to promote self-initiated cleanup. Self-initiated cleanup, excuse me. Some diversity, privilege, and social location issues consist of like CPRT is likely to support parental efficacy, which would be suitable for families of diverse cultural and ethnic backgrounds. CPRT toys will include a variety of characters to include, diverse family structures and cultural backgrounds. CPRT toys will also integrate toys from a variety of cultures to support inclusivity, and the space will utilize warm lighting and neutral colors to foster a welcoming and safe environment for families who may have been exposed to trauma. Toys such as doll houses, sand trays, and town rugs offer unique, unconventional opportunities for children to enact scenarios or engage in imaginative play with respect to their cultural beliefs and preferences. Okay, so focus of interventions includes an emphasis on family members' emotional, cognitive, and behavioral responses. During the session, CPRT therapists will work with the parents, both one-on-one, individually, to identify unmet emotional needs behind their children's expression of behavior during play. The therapist will support the parent's ability to understand children's play behavior as means of self-expression and will be encouraged to validate children's emotion rather than offer behavioral correction. The therapist will support parents' ability to effectively respond and redirect children's maladaptive behaviors with respect to the child's stage of development. And lastly, a core goal of CPRT and what separates CPRT from other interventions is that it does not have a focus on behavioral correction, but rather parent-child connection. A CPRT therapist will work with parents to empower their child's innate ability to self-regulate, move towards achievement, and move towards achievement. And second order change will occur when the child is supported by parental responses, which generalize to a variety of contexts. So the treatment process is very structured. The program is shown to be effective for caregivers in young children between the ages of 3 and 10 years old. CPRT is a 10-session filial model, which can be tailored to the individual needs of the family unit. And CPRT can be applied to single or dual parent family structures. The therapeutic model consists of at least 5 structured therapy sessions, which include a combination of learning processes offered through dyadic instruction, play demonstration, at-home play sessions, and supportive supervision to foster warmth, empathic, and emotionally responsive interactions between caregiver and child. Below, you can see some of the comments that were mentioned in the CPRT manual. Parents saying, researchers suggesting it's a must-have companion. It's given the profound research and support for CPRT. This model provides filial CPRT therapists with tools to forever impact families and classrooms. Interventions include, like I had mentioned, 10 sessions with at least 5 structured weekly play sessions. It's going to first begin with dyadic instruction to promote learning and teaching. In this stage, therapists will encourage parents to explore their own feelings, attitudes, and perceptions in a supportive group environment. And the goal of this stage is to validate, support, and guide parents into adaptively supporting their child through the sense of autonomy and connection with other parents. Once the parent has been provided with validation and psychoeducation, the CPRT will begin when 5 structured weekly sessions will occur in a non-judgmental environment. They will include didactic instruction to support parental sensitivity to responding to children's needs, modeling or viewing recorded play sessions between the children and caregiver and presenting those to the parent and offering supervision, role playing with the parent to practice skills before implementing them in the therapeutic session, and supporting supervision to parents during or after play session with supportive feedback and guidance. Some legal and ethical considerations consists of a confidentiality. So all CPRT therapists should be mandated reporters in the event of disclosure of suspicion of child, elder, or dependent adult abuse. All of those things must be reported. And upon intake during the informed consent process, CPRT therapists must disclose limits of confidentiality. In the event of high-risk behaviors, in the event a client discloses intent to harm self or other, therapists must follow safety protocol and conduct necessary assessments such as the Columbia Suicide Rating Scale and follow necessary procedures in the event of a crisis or a client is assessed high risk. Clinician must ensure client confidentiality in the event of care coordination or case management services outside of the therapeutic session. It must collect a release of information form prior to coordination. Telehealth recommendations. This model mainly should be in session, but it can be tailored to meet telehealth requirements or preferences of the clients. In the event of telehealth, CPRT manuals consisting of the structured sessions may be given to the parent to support the structured process. CPRT should only be conducted via telehealth if caregivers can ensure confidential space that supports the facilitation of creative discovery and expressive play. Upon request of telehealth services, caregivers must sign informed consent, say an additional informed consent stating that client's responsibilities pertaining to ensure client's confidentiality with respect to its environment, such as ensuring a private space, minimizing the potential for others to overhear, or positioning a camera and microphone in a way that aids the CPRT process. Okay, so briefly, I will mention 3 research articles that suggests the effectiveness of CPRT. In a randomized control replication study, CPRT was shown to be effective in improving parent-child dynamics for adoptive families, suggesting the effectiveness and reliability for diverse family systems. In addition, CPRT has been shown to be effective for families and children who have witnessed or experienced domestic violence. Here it says research has shown CPRT has shown children are able to become more adaptive, and problematic behaviors are likely to decrease. And lastly, researchers conducted a study on effectiveness of CPRT with parents in preschool at risk of school failure in the Head Start program. And at the end of the study, parents' stress was decreased, and there was a decrease in internalizing and externalizing behaviors in children's presentation following treatment. Okay, and then lastly, healthy communication between children and parents was also likely to increase following CPRT, with mothers' communication levels, emotional regulation, and empathic tendency to increase. And this was effective for children between the age of 3 and 8 years old. So this is a summary here of my presentation. So CPRT would be an amazing model for this company to adopt due to its high reliability, its validity, and its replicability, and an abundance of research. CPRT is highly reliable, and it improves the relational dynamics between caregiver and child. It supports parents' empathic responses to children's needs and reduces children's maladaptive behaviors. In addition, CPRT is shown to be effective for families of diverse cultures, ethnicities, and family structures. CPRT is also shown to support children's growth towards self-actualization while aiding in the connection of emotional responsiveness between parents and children. Child-centered play therapy is a great way, is a great addition to CPRT to support relational dynamics. And in addition, the client benefits of CPRT include being cost-effective. It's a cost-effective way to support the well-being of children and families, and it's an effective way to support parents in responding to the developmental needs of children according to the stages of development. And lastly, CPRT was shown to be a trauma-informed approach, being specifically effective for individuals that have been exposed to domestic violence or potential other forms of traumatic events. Below, you will see my references. This is my reference page for my peer-reviewed articles. And here is my reference page for additional research. Thank you so much for watching. I hope that you enjoyed my presentation.